right, so that's shot 12, correct?
Yes, sir.
Then 11, 10. Shot. All right. Shot. And we're doing what, 9, 10, 10, 11?
Yes, sir.
Correct?
Yes, sir.
No, 8, 9, 9, 10.
Yes, sir.
Which one? It's 8, 9, 9, 10. So 12, 11, 10, 9. Yeah, that's why it was a little bit confusing. So it's 8, 9, 9, 10.
Yes, sir.
All right, let's just look at L1 for a second. Make sure there's no ribs down there. All right, there we go. Looks good. Let's just see the whole lumbar spine just real quick. Make sure we got 5 lumbar vertebrae. For those of you wondering, let me see a little north shot. A little more north, just a little bit shot. So that's 5, 4, 3, 2, 1. Just a little bit north. Shot. 12. So we got, yeah, the first thoracic is the rib there is T12. Everyone agree? All right, now let's go back up. North, north. So we're going to start with our thoracic Duke laser disc repair. All right, so there's 12, a little bit wider, just a little bit wider on the field. That's good. Shot. All right, good. And then now let's go north a little bit. So that's 12, 11, 10, correct? Shot. That's perfect. Leave it there. 12, 11, 10, 9, 9, 10, and then 8, 9. All right. I'm going to start with the bottom, which is little num num, which is going to be 9, 10. You agree, Luis?
I agree, sir.
Nice job, Dr. B. We're going to be fixing 2 thoracic disc herniations and stenosis on the right side. I know. You always do your best. It's a pretty big guy too. Shot? All right, so we got 12, 11, 10, 9. Okay, go lateral. I'm sure I'm too superficial on this. So step 1 in these surgeries is gain access to the disc herniation and the tear right where it hurts. All right. We need a table up, please. Go ahead and get rid of some of that stuff on the right side of your screen there. Yeah. Table up. That's nice, actually. All right. You can see the spinal cord stimulator at the bottom. What do you think, Jordan? Where do you think 910 is? Yeah. You're probably right. You're probably right. I'm going to come a little bit lower. Shot. Get that wag fixed, please. You can see the offset on the pedicles. Shot. Shot. I think that's a little bit better. Yeah, we need to see a little more there, a little less on the other side. A little more. On the left side, bring it towards the spine. There we go, a little more. There we go. All right, that should be good. All right, well, with the wag fix, I think I was in the right spot the first time, which was up here. Funny. That's why the x-ray picture is so important. That looks pretty good right there. Shot. I feel the facet. Shot. think we're off a little on orbit. What do you think? Just a little bit, right? So I'm having there we go. I have to have, let me see, Sean. I have to have a technician help me by adjusting the fluoro so that I can have an accurate representation of the bony anatomy of the spine. How's his blood pressure? Good? AP? AP, let's see where we are. As I said, the first step is to safely place the spinal needle. Once the spinal needle is placed properly, the rest of the surgery honestly becomes much safer and easier. Oh, that looks good. That looks really good right there. All right, so let's see where we are. Come south a little bit. I think that's going to be 9-10, right? Yeah, because of that big bone spur there. A little bit, there we go. So there's 12, 11, 10, 9, 8. Is that right? No. 12, 11, 10, 9, and then 8 above. So I think we're at 9, 10. Does everyone agree? 12, 11, 10, 9. I think we're at 9, 10. 10, 9, 9, 10. Same thing. All right. Let's go back to a lateral view. So we're using two views, sideways and front back, to make sure we're in the right place. We know what disc we want to treat, but we have to get there. And we have to get there safely. All right, that looks pretty good. Shot. Let's see if, I think it's just his breathing. Shot. Try to take a shot when he's not like dynamic. There we go. It's probably a little better. I think we're off a little bit on WAG. What do you think? Like a degree maybe? It's really important, folks, if you're going to do spine surgery, you always want it other way. You always want to line up your bones properly. WAG. Shot. I think you're off on WAG. Now you're way off. I don't know why. I think you came south, Jordan. Did you ever go back north? Came south for the AP. Did you ever go north? All right, that's better. We're still off a little bit, but that's pretty good. Huh? What do you need?
I think we're probably going to have to change out the CPAP. It's not getting a good seal the way his facial anatomy is. You won't see it's not firing.
Sean,
Look at the side.
you want me to wait?
Keep going. He has a nasal on.
Sean? Shot? That's really good right there. Huh, Louise? Shot? AP? So we're right at the back of that disc at 9-10. Right where we want to be. Coming in from the side. It looks like on that view we just looked at, it's coming from the back, but we're not. We're coming from the side. You see that we're coming from the side? The lung fields look good. All right. So we've almost accessed this disc, which is 9-10. Then we're going to do the one above it as well. Now, he doesn't just have thoracic pain. He has horrible, horrible pain radiating around the side of his spine. We call it radicular pain. Okay, because it stands for radiculopathy. I can feel the bone spurs here. It's horrible. There we go. We're in. Uh-huh. All right, let's do the next one. Is he okay, doctor?
Yeah, I think we might have to change out the mask. So we'll see.
Well, let me know.
We might have you locate
Shot?
these two discs.
Sure. Yeah, no problem. I can wait.
We're not getting the seal that
Shot? Yeah, no problem.
Sometimes you don't get a seal, it's not going to give the positive pressure. So
I
we might just go
understand.
back to the old-fashioned.
Shot? Just whatever's safest for the patient. Are we broadcasting?
Yes, we are.
All right, so we're almost at the next one. Excuse me. So Dr. B, after I place this, we'll need him awake, because we're only doing 2 discs, so we can wake him up. Gosh, that looks pretty. All right, back to a lateral. Again, this is a surgery called transforaminal because we're going through the foramen. And we're going from the back, posterior transforaminal. Yep. And he has really actually pushed my needle backwards. How funny. Shot. All right. Shot. Whenever you're ready, I'll take him awake. Oh, yeah, there's a tear there too. I think these are the two discs that are going to be his problem. He's going to get good results here. Okay. So we're going to let him wake up completely, and then we'll put him back to sleep one more time.
Yeah. We'll kind of do two things.
So we've got two needles in. One is in the T9-T10, and one is in the T8-9. It's the one above. And just so you guys understand, what is 8, what is 9, what is 10? These are the vertebral bodies of vertebrae. This is the T8 vertebrae, T9 vertebrae, T10. And we're dealing with discs that have been damaged. And these discs act as a cushion between the vertebrae. The other thing he has is a stimulator. Okay, you guys see this over here? Stimulator.
Yes, we do.
All right. Where's my num-num? How much longer? A few more minutes? Perfect. Well, while we're waiting, now all right, I'm going to write a number here for our audience. Where's the other cut?
You okay? Hey, don't move, okay? We got to ask you some questions. Don't
It's
move.
thoracic up there.
Don't move, all right?
You think or no?
Let me see, because we don't see it over there. When we do the IP.
Uh-huh.
But I see a cut over here, so
There was a scar somewhere here.
you wanna do IP?
Huh? I think it was here. Let's get an AP. How much longer on him?
He's getting there. You okay, my friend? You ready? Don't move. All right, he's okay.
All right, let's just wait. Let him wake up a little more. I want him to be 100%. AP here. Coker. Watch the needle. Shot. Yeah, that's where it is, right there, Luis. See it? See it? Yeah. So that's where the anchors are for the stimulator. You guys see the wires here? Let's show the audience the wires. Okay. Yeah. Perfect. Yep. So right here, they made a cut in his spine, and they stuck these wires up his spine. Go up north. You guys see the wires that Jordan's showing you with the white arrow?
Yes, we do.
That's the spinal cord stimulator. Keep going. And it goes all the way up. Keep going. Up, up, up. Up, up. Look where they stuck those wires. All the way up his spine. There they are. There's the electrodes. Okay? They're way up there. We're at what? T8-9, 7-8, 6-7, 5-6, 4-5, 3-4. I mean, Jesus, that's right at his cervical spine.
How you
So
doing,
that's
my friend?
right up there at
Don't move.
T1, 2, 3,
Just wake
4.
up. We're gonna ask you a couple questions.
So those are useless, okay? I'm going to write something here for you. Come on back. And go lateral. Let's get lateral for a discogram up there. All right. Everybody there? You guys see this?
Yes, we do.
Don't move.
What
You're
number
okay.
am I writing?
We're gonna ask you some questions now. Dr. Duke is gonna ask you
4,
questions.
5, 45,000.
$45,000. That's what the surgery center gets paid for putting in one of those stimulators. It costs them around 20, maybe 18,000, 20,000 in costs. So they're making $25,000 profit. That's why they're pumping these stimulators into everybody they can. And it's all being promoted by the implant companies. Harming patients like him. He wants it out. You doing all right, buddy?
Don't move. Don't
You
move.
okay?
Don't move. You're okay.
You okay?
Don't move.
All right, we wanted to wake you up because this is your moment.
He's watched the videos.
This is your moment. You came all the way from Chicago, right?
Great state of Illinois.
Why'd you come to Duke Spine Institute? He's back asleep.
9 years of back pain that caused him to retire. Yep.
How long have you had pain for? Huh?
What'd you say?
Alright.
9 years.
9 years. Thoracic pain for 9 years. And it was right here. All right, are you having any pain? You having any pain? No? Are you comfortable?
Are you comfortable?
How bad is that? You guys see that arching up and ow, ow, oh, he said. How bad is that on a scale of 1 to 10? How high?
8. He just said an 8.
It went up to 8. Is that where you get your pain typically? Is that where you get your pain?
Yeah.
Yeah. All right. He's still not 100% awake. He's still a little foggy.
He
Yeah,
says his pain is higher than that.
yeah, but he had it there. Are you comfortable now? All right. Is it better? Is it better?
How's your pain doing now?
Is it better? Don't move. Lay still. You're doing good. We're almost done. We're going to put you to sleep soon. Just lay still, okay? Are you comfortable? Are you comfortable? Okay. No pain? Ooh, you see, it stopped him. How bad is that on a scale of 1 to 10? 10? Is that where you get pain? Is that where you get your pain? Yeah, is that the area you get your pain?
Over to the right more.
Right, I understand. But in that area of your back, is that where you get the pain? Yeah. All right, good. He was saying to the right more, which we know the pain's wrapping around his ribs. All right, so, but you saw him when I injected him. He arched his back. I didn't tell him I was injecting. He had a lot of pain. I need you to count out loud from 1 to 100. When you wake up, you're going to be done with your surgery. Yeah, take your time. Now you're going to feel a little burning in your arm. That's the medicine that's putting you to sleep. Is that person gone yet?
Yes. Just left.
How you know, Bob?
You have a good idea of what we're going to be dinged for?
We got a different one.
I think so. He had a lot of opinions, though, so I don't know what's opinion and what's...
Well, that's the problem. So there's a standard, right?
Right.
And it say something like, label your medications, right? Well, label them with what? Like date, time, right? What are you labeling them with, right? So that's where he gets to fill in his opinion. And that's what bugs me about the whole thing, is that you get different opinions from different people.
Right.
But that's why it's a good experience for you. Take your time. How's he doing?
He's fine. We have to change up the whole mess. It's tough when they're in a trauma.
Take your time. Hey, man, safety first. First, second, third. All right, Henry, while we're waiting, go ahead and show us a video of how is it that these disc herniations cause so much pain. So how much time you need, Bernadette?
I don't know, like a minute or two. We're going to go off to sleep very slowly.
No, I need a number 10.
Oh, you're going very slowly off to sleep, okay?
Why
my
the hell
friend?
not?
Couple
Why not?
nice, slow, deep breaths.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. We're going to move to the spinal cord stimulator removal. The first thing we're going to do is a generator removal. All right, we've just made a cut on his flank where this generator is. You can see it right there. You guys see it, the metal? Hold that over. Come on, Luis.
Yes, we do.
So this is what they charge $20,000 for to the patients and their insurance company, or actually to the surgery center. They charge 20 grand for this thing.
I think we're doing better without the CPAP on it.
That's fine. Can you guys see this? We're going to give birth. We're about to give birth here. Yeah, you have a coker? Trying to keep the pocket small. Here she comes. You guys see that?
Yes, we do.
All right. $25,000 depending on the model. Huh? Look at this thing. Just put in, I don't remember, maybe a few months ago, 6 months ago or something. Says it doesn't help at all. Anyway, it's a shame. All right. Hold that generator. My son and I were just talking about this whole abuse of these doctors putting these things in patients left and right. They don't work. They don't last if they do work. He said the trial worked, but what they do is, look at that. The charge is going straight to his spinal cord, causing him to buck like a bucking bronco. Oh yeah, we're going to get the leads out. No problem. All right, give me a Raytech with some betadine. So we got that guy out. We'll just leave it out for a little while so you all can see this. Henry,
Yes, sir.
when we do our website and we talk about spinal cord stimulators, show them this beautiful picture here.
You got it.
Let's get a light on here.
Yeah, a little onto
Put
the
it back.
a little more to the left. Yes, perfect.
I'm just putting a betadine soaked sponge. This is it right here. See that, guys? Stimulator right there. Look at that. That's what they put in you. And then the wires going up there. We're going to get those wires out in a little bit. But I'm going to go back to the laser surgery first. We just did that because we had some time. Alrighty then. You guys ready? Here we go. Going back to fix his discs. This is why he had the stimulator put in. They just did, if they sent him to us to fix his back, they wouldn't need a stimulator. No. We're going to do lumbar, right? I want lumbar.
Can I have
Oh, all right, cervical. Let's try cervical. If we need to, we'll go lumbar. Well, the discs are pretty big.
Sorry about the big breaths there.
Sorry about what?
The big breaths seem safe.
It's okay. I don't mind the breaths. I like breaths. I'd rather the patient have breaths. Show them the wires for the electrodes there on that picture. You guys see those wires running up? We're going to get those out later once we're done with this shot. Luis, I would get the lumbar.
The lumbar?
I think we're gonna need it. Now, Berndes, that's him.
Oscar,
That wasn't me.
can I have the lumbar with working stick? Working scope,
That's him.
and a different laser fiber, please.
You're fine.
Laser fiber for the lumbar, working stick, and a lumbar scope, please.
Do you understand, Oscar, what we're asking you for? Lay still. You're okay.
You're all right, you're doing great. Okay, my friend. Okay.
Maybe. I think it will be. That's not my primary concern. Okay, what are we
my friend.
what are we doing to get him more comfortable? Dr. B? I think a lumbar. I think a lumbar is going to be better. Guide wire. Let's run our video, Henry, on how the Duke laser disc repair works. Shot? Shot?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, some num-num. At this point, we've changed out to a larger system because his discs are big. And I'm going to give him some more numbing medicine, make him comfortable. Shot. Shot. All right, I've numbed up what I can. You okay? Yeah, I understand. Huh? No, don't give him much sedation. Let's keep him just right when I need it, Berndes, okay? Like I'm about to need it, so this will be when we want him a little more sedated. Does that make sense? And then you can, yeah, he's not responding. And then you can ease off. But at the moment I do this is when it hurts the most. Shot. All right. Take. Don't worry about that. You support me right now, Luis. We're about to be done with the stimulating part that bothers him the most. Hold on. Shot. 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 All right. Good. Done. You're going to need the thing. At least he's moving air well. You're just going to have to do him with less sedation. You got it moving or not? Shot? Yeah, it's coming. Definitely. Shot? Perfect. All right, we're in, by the way, so you can lighten them up and keep them lighter. I'm just saying.
Hey, my friend. Open your eyes for me.
Get the cervical laser fiber off the field. Or just, actually, you know what, keep it there, it's fine. Just keep it there, it's fine. I need our irrigation on. We got it, Jordan. Pump on. All right. Grab her. Well, grab her. Grab her.
How you doing, buddy?
Take it out and open it. Open the other side of it. Jesus Christ, Oscar.
How you doing, buddy? Okay.
We understand. Laser.
We have a question.
Sure.
This comes from JMC on YouTube. And they asked, what's the best muscle relaxers for the spine?
Hey Jay, there's no best muscle relaxers. It's just what works for you. Everybody's different. The best ones are going to be ones that are not addicting and they work. Muscle relaxers are not a way to treat pain. That the only reason you should take a muscle relaxer is if you just had back surgery and your muscles are tight while they're recovering. You shouldn't be taking a muscle relaxer without having had back surgery. In other words, muscle relaxers are not a treatment for back pain unless you're treating muscle spasms. Is he okay, doctor?
We're
Yeah, I would back off on sedation.
The problem is I can't, his head is
Yeah, no, I mean, in retrospect, given his poor response to the anesthesia, I think general endotracheal would have been our best bet here.
well, we didn't know that.
Yeah, no, I agree. No way to tell.
We should be okay with the DPRs. I can give him a little bit for that.
Yeah,
We just gotta get to the second.
I understand. This is all, this disc is just messed up.
Try to use a little more local maybe on the second one. So that helps.
I use tons of local, but I can do, yeah, I'll do more. Sure, no problem. I'll do what we can.
I had to give him Narcan, so I took out his narcotics.
Yeah, it's wonderful.
We have a oral airway in him prone with Narcan.
It's unreal, huh?
Not ideal.
So what about, which is better, like patients uncomfortable, propofol or fentanyl?
Everyone's a little different. It's hard to say, but most of the time you get a little fentanyl that has pain. Propofol has no analgesia.
That's where the pain's coming from. You guys see the orange stuff right there? That red thing? Here, come on, Louis, stay with me. This will wake him up. So this patient's been suffering with thoracic disc pain and radiculopathy as a result for many, many years, unable to get any relief or help. They did a spinal cord stimulator. I showed it to you. We're going to get it all the way out in a few minutes. We got to finish a few other things first. Just about done with the first disc. We're just at the back of the disc here. Basically, I'm shaving the herniation down using a laser. There's a nice piece of herniation right there. That was pushing on his nerve here on the right. I use a combination of the grabbers and the laser. Most herniations, by the time we get to them, have been around for a few years. So there's a lot of scar tissue, a lot of calcium deposits, and those things they just don't respond well to the grabbers. The grabbers can't get them out. Everything is scarred down. The grabbers can't get rid of scar tissue. So we have to actually use the laser to start shaving down the scar tissue and the bone spurs. Without the laser, we couldn't do the surgery. Nope. Just getting a piece of herniation out. How's he doing otherwise? Doing better? Huh?
Yep.
Thank you. Safety number 1, 2, 3. Almost done. Then we'll move on to the next one. Yeah. I got to come out a little more. That should be good right there. Sorry for the poor visibility, but that's how some of these surgeries are. Good thing I know what I'm doing. You know, the thing about these surgeries is once you get to where you need to be, which is where we are, right in the back of that disc herniation where the tear is. Once you get here, the reality is that it's pretty much the same surgery for everybody.
Thank you.
There's not a lot of decision making that has to be made. It's just get the job done and move on. Any questions from the audience, Henry?
No current questions, but we do have a couple comments from Canes25 on YouTube.
Yep.
And they said, Doc, I have severe tendonitis in each extensor tendon, aka tennis elbow.
Sure.
It's a tough ailment to cure. I'm hoping someday your technique could debride the damaged part of tendon. Watching your laser work, I don't see how it wouldn't be a home run. Maybe you're a new orthopedic doctor in the future, something. They want to cut and release the tendon and debride the epicondyle open surgery, but I won't, but I suffer.
All right, we're pretty much done here. Lay still.
Lay still. You're okay, buddy.
So basically, tennis elbow is something that is treated with shots. And we do it all the time. And sometimes it takes 2 shots, sometimes it takes 3 or 4 or 5. Come on. I don't need this yet. I only put a drop in there, so why would I need to take it out? It's the irrigation I really need. You're okay.
How you doing, buddy?
Great. Bring a emesis basin.
You all right? Got suction? How you doing? Okay, my friend, you're doing fine.
Did he vomit?
No.
Just airway secretion? All right. Lay still. Lay still.
What's the matter? What? What's the matter?
Let me have a scissor. Heavy. Let's get some suture and close this. Lay still. Don't move. Irrigation.
Don't move your arms.
Suction. Suction. Get some suction.
How you doing, buddy?
You're all right. No, that's what I'm thinking too. Suture. I'm not either. I think we're going to have to bring him back and do it under general. Pick up. Let's go. Keep the fluoro out. Switch places with me.
How you doing, buddy? You all right?
Hold pressure. All right, we're going to have to close this patient up and bring him back and do his surgery under general anesthesia because he's not tolerating what we're doing. Try to help him a little bit, doctor. Give me a stapler.
What's up?
Lay still.
What? Your shoulder. Which one is it? Both of them. Your shoulders.
Your shoulders hurt?
Okay. We're gonna loosen it up for you. All right? Sure.
Get that closed.
Is that okay like that? Both of them? Okay.
Lay still. We need you to not move.
Jordan, start bringing the bed, please. Yeah, thank you.
Fluoro out. You have a stapler for us?
I got it right here.
I know, we're gonna get you up soon. Needle here. Relax. You're doing great. You relax, don't move. We need you to lay still. We're almost done. Lay still. You're doing all right. Lay still. You're doing great. Everything's good. You're good. Watch it. That's the last one. You got the staple up there? Almost done. You're doing good.
Almost done.
Hang in there.
This off.
Hey, come on. You're from Chicago. You Chicago guys are tough. Right? You have a polysporin. Almost done, my friend. Almost done. You're doing awesome. All right. You're done. We're just going to clean you up. Lay still, all right? We're almost done. You did great. You did great. You're good. I want to get a bandage on here. Okay, well, we had to, I'll come talk. Type up your questions. I'll be right there. Great job, everyone. You're okay. Just take a few deep breaths. Don't move. All right, Henry, you want to do testimony? Good morning, I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day. And I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional because it is an emotional thing. When you've been burdened with this pain for so long and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Duke laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together, and I requested an MRI from my doctor.
Good morning, I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke. And Dr. Duke Majan here. We have just wrapped up a Duke laser disc repair thoracic, as well as a half removal of a spinal cord stimulator. The patient, unfortunately, does not tolerate the type of anesthesia we're giving him very well. And it's made it very difficult to continue his surgery. So we've decided, for patient safety, to abort the surgery. And we're going to bring him back probably next week and do it under general anesthesia, with him completely asleep, with a tube in his airway, so that we can put him deep and comfortable and not worry about him having any kind of problem. So we got about half the surgery done, and then we realized, you know, he's just not staying asleep, and anything we try to do to him we can do safe is just not keeping him asleep. And he was starting to come off the table. It was time to get things closed up and get him recovered. So at this point, we got half of everything done. We're going to do the other half on next week, probably Tuesday if I had to guess. Maybe Friday at lunchtime, we'll see. We're gonna just take a look and see. I know he's here for a week. He's staying with family. So if I can get it done tomorrow, maybe, but we'll see. I have to talk to my team. But we're gonna get it done. And we're gonna get it done with a tube down and him completely out, so we're not struggling. Any questions?
No current questions, but we do have just a comment from Kane25 once more on YouTube saying, Doc, this was towards the end, Doc, you were as cold as ice, no panic in you ever. Cool, calm, and collective. I wouldn't want anyone else in charge of me in the OR. Purely professional as they come.
Well, you know, it makes me happy that someone can appreciate what's happening and how we respond as a team. And you're right, you have to be cool, calm, collective, level-headed, and always thinking ahead, what's going on. You got to look at the whole picture. Here's a patient who's, you know, large and has a really difficult airway. And to make things worse, these people are position prone, meaning they're laying on their belly, okay? And he was really uncomfortable. I guess his shoulders, the way he was laying in the surrender position, his shoulders were hurting him. I guess he's got shoulder problems. So he was uncomfortable. It wasn't even the incision in his back that was bothering him. He was saying, my shoulders are killing me. My shoulders are killing me. So, you know, a lot of the people that come here, they've got arthritis throughout their body. And we obviously weren't fixing his shoulders today, but just laying there on the table for an hour made his shoulders ache. And so that's all he could think about was getting off that table. And I realized we were, you know, in a situation where there's no way we're going to be able to put him down again and make him sleep. So he was coming up, and I saw that, and I knew it, and I knew we had to get things closed up quick, and we did. So I was pleased that, obviously, given the circumstances, we did what was right, and we did it effectively and at low risk to the patient, so he should make a full recovery. On the other hand, I'm disappointed. Obviously, we didn't get everything done, but you know what? Safety is number one, number two, number three. I don't want people paying a price other than the money they pay, obviously. I don't want them paying a complication price for their surgery. I like surgery that doesn't have complications, and we've been very successful at doing 1,600 surgeries with only really one complication. So I'm happy with that, and I want to keep that for the patients. Because nobody should ever have to go to surgery and come out of surgery with a complication, you know. And so I always put myself in the patient's shoes, and I think, well, what would I want? I certainly wouldn't want a complication, okay? So you got to weigh the risk and the benefit. You got to make decisions quickly, effectively, and that's what we did. Yeah, 26 years as a neurosurgeon. You know, honestly, I was pretty equally tempered back when I was in year one, about the same. And my attendings used to say, you have the California cool. They call me California cool. That was my nickname back in residency. And anyway, thank you. Any other comments?
Yes, one comment from Brenda on Facebook saying, I have 3 bulging discs and a pinched nerve on disc 5.
Well, Brenda, my advice to you is Henry will type up our free MRI review. Please fill out the form, submit your MRIs to our website, or mail them in with UPS or FedEx. We will look at them for you, and I will meet with you and tell you exactly what I think needs to be done to get rid of your pain.
And that is it for questions.
Wonderful. Well, we got one more surgery to go. This next patient is from, I don't remember where she's from.
Well, Florida.
Oh, Florida. She's a local. So we're going to be doing lumbar, lower back, bilateral L3-4 because she's got herniated discs on both sides at L3-4. We're going to go in and fix both those herniations, and then I'm going to go left side L4-5. So we've got really 3 disc areas to fix on 2 discs. She's got horrible back pain and leg symptoms, actually a lot of leg symptoms, so I think she'll do well. But that'll be our last case for today, and then tomorrow we may be putting on this gentleman that we just did, but asleep, so I can finish the surgery properly. Have a nice day.